Hello to all. It's 9:01, so we'll get started. The theme of our side session today is improving hygienic environments for infants and young children. I'm Julia Rosenbaum with FHI 360, serving as WASH Behavior Change and Integration Advisor to the USAID WASHPaLS project. So to get us started, I'm going to ask everyone to please go to the polling platform on Pathable. I think you've all practiced doing that now. And we're just going to start out by having you tell us a little bit of who's here in our Zoom world. So if you could please go to the first two polls and tell us who's in the room and what's your technical and topical focus. And please vote. For those who are slowly coming into the room, we're now on the polling section of who's in the room. So if you would go right to your poll tab. A few housekeeping details while we're getting started as well. We really are encouraging an active dialogue in the chat. Different sessions are handling it differently, but we are actually using the chat tab where you are, the chat tab. And we ask you please to ask your questions, comments, and engage in some active dialogue. Great. And can we get back to the polling results now? See who's in the room? Lily, can you get us back to those polling results on the share tab, please?
I don't think I can see the polling results.
I'll look for us for a minute, and otherwise we're just going to keep on going. Okay, I don't want to hold us up anymore. The polling results aren't showing, so I'll just keep on moving on. Thank you again, and welcome to What the Cluck, Improving Hygienic Environments for Infants and Young Children. So I'm going to briefly set the stage for you all, providing some key background data that applies to all the presentations that follow. There we go. Thank you. So again, I won't be presenting a research or scientification myself. This is the stage for all of the presentations that follow. So growth stunting, which is characterized by a low height or length for age, is an outcome of chronic malnutrition. And despite decades of nutrition intervention, stunting remains prevalent in most low and middle income countries, often hovering between 30 and 40%. Stunting doesn't just mean smaller people, shorter children. Chronic malnutrition has both short and long-term, excuse me. It has both short and long-term effect on health, on cognitive and motor development, on learning, on productivity, and on wages, as well as reproductive health. So it really stunting seals that cycle of poverty. A stunted child will never learn or never earn their potential. So when you think about 30 to 40% stunting in a country or a region, it's really stunning. And what it means is that 30% are compromised from the start, and they can't bring their best to their personal or community development, to their problem solving or innovation. So the F diagram that's known to most in the room, its original focus is on that relationship between human feces and disease. But animal feces have been shown to contain enteric pathogens that contribute significantly to the global burden of disease in low-income countries, particularly in rural areas. Several studies have documented significant sources of animal contamination in domestic environments. So even if there aren't human feces in the domestic soil, there will be animal feces. Of all the zoonotic diseases carried by animals, we're particularly concerned with Campylobacter due to its association with growth faltering. And Campylobacter is primarily carried by poultry. Thus our title, What the Cluck? Next slide, please. So again, thinking back to the classic F diagram, the pathways of exposure don't hone in on infant-specific pathways, where the fomite F of the F diagram looms large. Exploratory mouthing of fecally contaminated objects, direct ingestion of animal feces and soil, they play a larger role in the transmission of disease to infants and young children than was previously recognized. So taking into account these previously unexplored sources and pathways of transmission, the predominant household wash interventions that are limited to sanitation and latrines, water improvement, are likely inadequate to block that fecal transmission that's particular to infants and young children. The infant-specific risks and pathways need to be addressed, but the effectiveness, adoption, constraints, and scale-up potential of the measures for reducing infant exposure, things such as play mats and playpens, improved flooring, modified animal husbandry, are only recently being explored and documented. So that's precisely what we'll do today. We'll be hearing some findings from research activities focusing on these neglected sources and pathways. So if not traditional wash, then what? Today's session is going to feature 6 rapid-fire condensed presentations spanning possible innovations to improve hygienic environments for infants. The first 3 focus on altering the environment to facilitate improved practices that are hypothesized to improve health and growth. Then we'll take a few questions, have some fun and games, and move on to a second set of 3 presentations that will be focusing, still go to the slide before, please. The second 3 that will focus primarily on the infant, specifically on improved feces management and child play spaces. Next slide, please. So 4 of today's 6 presentations, next slide, if you would, please. 4 of today's 6 presentations are recipients of the USAID WASHPaLS Project Behavior Change Innovations Small Grant Fund. Very quickly, WASHPaLS stands for Water, Sanitation, and Hygiene Partnerships for Learning and Sustainability. We're a 5-year research and technical assistance project with the goal of enhancing global learning and adoption of evidence-based programmatic foundations that are needed to achieve the SDGs and also to strengthen USAID's WASH programming. WASHPaLS includes a $1.5 million small grants program to explore behavior change innovations that address WASH challenges. We've issued 9 small grants, and you're going to hear from 4 of those today. So next slide. So for today's session of What the Cluck, Improving Hygienic Environments, we have a number of convening organizations listed before you. On the left would be our grantees, and you can see the university implementer pairs, and on the right, a few non-recipient conveners. Thank you. Next slide. So as our first presenters get ready to present, we promised you PoultryPoo Haiku. As we were preparing our reduced 50-word abstract and limiting our 2-hour session to our originally planned 2-hour double-side session to 75 minutes, we remarked that we'd have to be lean and mean, strategic in our presentation, and it would be like writing haiku. So, well, that's where this led. So really to augment the background, and we feel sums up our challenge, we offer our framing here, which would be chicks under the bed, tasty dirt outside, sick kids, what to do for health. Thank you. Next slide. So as you listen to the presentations, the 6 presentations to come, we suggest that you take some notes and think through yourself first of these 4 questions. What elements of risk resonate with your particular intervention environment? What aha method or moment strikes you? What are some lessons or learning that you could apply to your situation? And what would you need to change or adapt to make them relevant to you? So with that, let's launch into our first presentation. We'll hear from Chris Protis, the Executive Director of the Water Trust, who together with his colleagues from North Carolina State University in the wings, Drs. Eckerman and Harris, will present on improving poultry management and reducing child exposure to poultry feces in the context of a savings and loan program. Take it away, Chris. Thank you.
Okay, great. I'm unmuted. Thanks, Julia. I'm going to get right to it as I only have 6 minutes. This project, which is focused on improving management hygiene in rural Uganda, it started last July, and we're actually just finished implementation in August due to some delays with COVID, and we have end-line household surveys being conducted right now. So I'll be presenting our sort of interim findings as well as background on the project itself. Speaking on behalf, I think, of all the WASHPaLS grantees, our presentations are made possible by the support of the American people through the United States Agency for International Development, and the contents of all of these presentations are the sole responsibility of each NGO or researcher, including the Water Trust, and do not necessarily reflect the views of USAID or the United States government. So very briefly, moving on to our research questions and methods. The fundamental challenge here is that households are investing very little in poultry management. That's time and money. And as a result, chickens are roaming freely during the day and defecating in the compound, as well as often sleeping in the home at night, exposing children to chicken feces. And our question is, can we change this? And if so, if we do change these behaviors, does that change actual exposure to chicken feces for young children? And does that have an impact on health outcomes for us? That health outcome of interest is caregiver reported diarrhea in children under 5. And then underlying this, obviously, we want to look at what are the mechanisms behind these effects, whether knowledge, attitudes, and practices are influencing whether people adopt these practices or not, or if there are other external factors that play a role. And to look into this, we have a randomized controlled trial across 100 communities, as well as microbial soil sampling in both treatment and control households. And we also do have qualitative research, including focus group discussions and key informant interviews. Next slide, please. So in terms of our intervention itself, as Julius mentioned, we do form savings and credit cooperatives that we call self-help groups to finance well maintenance and repairs. This intervention targeted those group members for this training. The training we broke into 3 phases. First is a triggering session, somewhat similar to community-led total sanitation, where we're trying to increase the perception of the child health risks, as well as livelihood losses associated with current management practices to motivate adoption of new behaviors. That's followed by skill building over 3 days, very practical based exercises on how you build these facilities, how you clean them, and things like that. And then finally, follow-on coaching and troubleshooting at the group level. So because these groups meet each week, we target these groups for follow-on training and support. And as I mentioned, COVID essentially created a 3-month delay between training and coaching visits. Initially, we were planning to wrap up implementation around May. Instead, we wrapped up around August, and that had an impact on our program. In addition, COVID disrupted the savings groups and their amount of capital that they could provide. We added a chicken loan to try and see if we could catalyze more investment later in the program. And I'm happy to talk more about that in the Q&A. Next slide, please. So what are our interim findings? First of all, I would caveat this to say these are our internal monitoring findings, not the RCT results, which will be coming later in 2021. I think based on our program monitoring, we believe that there's been a significant increase in the perception of the risks of current practices. And it's possible this will translate into improved hygiene as reflected in the household surveys, such as separating chickens from children at night, which doesn't necessarily require a new facility. It might just require shifting where they are in the home. Of course, it's hard for us to monitor that as it's a nighttime behavior. And it's certainly possible that those sorts of changes might have a health impact. At the same time, I would note that we do not see an increase in the construction of key facilities, such as a chicken house or chicken run, which are major points of emphasis for us. It's possible that the loans, which occurred late in the program, may change that, and we'll see in the end-line surveys underway now and into November whether that actually does result in a later change in the number of facilities and the associated behaviors. Next slide, please. So in terms of our implementation challenges related to that, so our staff found that households saw chicken houses as foundational for many other changes like a chicken run. So while we thought of them as different options you might choose piecemeal, for them, the chicken houses were really fundamental. And as this is the highest cost change to make, highest cost facility to build, and this occurred during the COVID-19 cash crunch in rural Uganda. This was a real bottleneck for change in other areas, such as constructing a chicken run. And I would just note that we have added some really interesting questions around perceived difficulty and self-efficacy in our household survey, and it'll be really interesting to unpack some of these barriers and dynamics in that analysis. Next slide, please. All right, so the chicken poverty trap. To me, this is a really important idea where essentially households have enough chickens that expose children to risk, but not enough that they're seen as a livelihood-worthy investment, in part due to the high fatality rate from disease, theft, and predation. And this is a critical challenge. And on Tuesday, Jeremy Lowe did a presentation that shared some of our results from our baseline analysis, which also added another dynamic here, which is that even if you improve the facilities, you create a structure for chickens, they're not always used. So in addition to the chicken poverty trap, we have an issue where even if you have facilities, they may not be used consistently enough to reduce exposure to chicken feces for children. So that's another kind of key issue that we're seeing in play here. And I think the bigger picture implication for us is that there's just a lot of behavioral complexity. There's lots of potential points of failure and unknowns, from the risk of disease or theft dissuading long-term investments to the need to feed chickens if they're not free range, and unknowns such as what's important. Is it nighttime? Is it where they are at nighttime? Is it where they are at daytime? What's the importance of corralling versus cleaning? We don't really have great data on these questions, and that's what a lot of us are trying to get at in our research that we're presenting here today. Let's see, next slide, please. All right, so reserved enough time to spend a little bit of time here before wrapping up. So thoughts on future research. Again, these are our monitoring results. I want to really emphasize that. We have some really robust household surveys and soil samples, which we'll be collecting shortly and presenting on in 2021 and publishing then. This will provide a really rich data set of knowledge, attitudes, and practices related to chickens, health outcomes, and other household characteristics. And the second bullet here on comparing it to human sanitation may sound provocative, but I hope in this brief time I made a decent case that not only is poultry more important to WASH than many of us thought a few years ago, but it's also a really complex intersection of behavior change, and it's an issue that frankly livelihood organizations have struggled with too, in terms of how you help households improve their poultry management. In looking forward, I think we need a lot more research in this space, both in terms of potentially looking at asset transfers that might help transform the environment more, such as constructing chicken houses. Obviously, we're looking at loans, and we'll learn something from that here, but that could be just a cash transfer or an asset transfer. In addition, I think looking at if there are other ways in which we can change these behaviors by increasing risk perception through radio, IVR, public address systems, that's relevant. And then overall, I think what you'll hear today is we're all trying to explore what are different types of strategies for containing contamination, whether it's chicken houses, increased cleaning, fenced-in porches, or verandas. And I think that there's a lot of work needs to be done there, because as an implementer, you really don't know where to focus. And that's what we're trying to learn more about here. So again, I'm thinking about 6 minutes, so I'll wrap up and just thank you all. And please do share any questions, and I'll share some resources in the chat as well. Thank you.
Thank you, Chris. And I think, again, in your call for really looking closer at some of these behaviors again, and how we can promote safer management of chickens with incentives of income and health, there's a lot of insights that are flowing. We're going to hear another presentation that's also looking to try and reduce children's exposure to feces, this time in Bangladesh. And we'll hear from Liz Thomas, who's presenting from the Hopkins Bloomberg School of Public Health, for Tariq Huda, who unfortunately can't be with us because of COVID. So we wish him well, and thanks, Liz.
Thanks, Julia. And thanks also to Tariq Huda, the PI of the study, for preparing this presentation. I'm happy to present it on his behalf. Today, I'll be presenting on one component of our project, Household Problem Solving to Reduce Children's Exposure to Poultry Feces in Rural Bangladesh. We had two main objectives for this project. The first was to identify existing strategies of backyard poultry raisers that could separate children from poultry and poultry feces. And the second was to co-design, test, and refine those strategies to be able to best separate children from poultry feces. And in order to do this, we did a modified trials of improved practices in 30 rural households that were raising poultry in Bangladesh. And we asked households to try either one nighttime or a daytime confinement strategy for 4 months. And those included a well-ventilated multi-compartment shed to keep birds in at night, a corral on or off the compound to keep chickens in during the day, a corral around a pond to keep ducks in during the day, or an enclosure of the veranda to prevent poultry from entering the house. And we visited households over the period of the tips to learn more about their experiences with constructing the strategies, using them as recommended, and then the maintenance or upkeep of them. And I'll go into those findings now. So for the multi-compartment shed, we found that construction really did require a skilled mason, and that most materials required were higher cost, with the strategy costing between 50 and 100 US dollars. However, with respect to use, most participants really did keep all of their poultry in the sheds at night as recommended, though some did keep laying hens inside the living space still at night. In terms of upkeep or maintenance, households said that the shed was very durable and that they would be willing to repair it and modify it in the future as needed, though some said that it was difficult to clean. For the corral on and off the compound, most materials were readily available and lower cost, with the strategy costing between 20 and 30 US dollars. And it was easier to construct, so household members could actually build it themselves, but finding a suitable place for it was a challenge. And with respect to use, we found that poultry were really not kept in the corral for long periods of time. And this is because birds were not used to being enclosed, so that they would fight together or try to escape. And households also did let them go during the day so that they could eat as well as reproduce. We also found that households said that extra poultry feed was required for when they were enclosed. In terms of maintenance, the corrals did require a lot of repairs and modifications frequently, such as adding netting to the top to prevent birds from escaping from there, and netting to the bottom because chicks would come out from underneath. But some households did say that poultry feces, because they were concentrated in one location, were easier to clean. For the corral around a pond, again, we found that materials were readily available and lower cost, and it was easier to construct, with the strategy costing between 4 and 7 US dollars. But it was really difficult for households to surround the entire pond with a corral because of lack of pond ownership. And in terms of use, there was a concern that the corrals couldn't be monitored to prevent predator attacks during the day, and that ducks wouldn't be able to access their food sources. In terms of maintenance, unfortunately, the nets that made the side of the corral collapsed pretty early on because they became loose, and these strategies were not rebuilt. For the enclosed veranda, again, construction was a little harder and may require a mason for some households. And this strategy cost between 20 and 35 US dollars, depending on the size of the veranda. But it's also important to note that households needed to have their own veranda to be able to participate in this particular strategy. And in terms of use, we found that the enclosed veranda didn't quite address our goal to separate children from poultry at night, and also in the courtyard during the day. And that access to the veranda was impeded, access for other activities was impeded because of the enclosure. And in terms of maintenance, we found at the end of the tips that most households had abandoned the strategy and repurposed the materials. However, on the plus side, some did say that because of the enclosure, chickens had become habituated to not entering the household during the day. So what were our main findings from the tips? In terms of daytime confinement strategies, we found that these are relatively low cost and easy to construct for households, but there are multiple challenges with confining poultry during the day and upkeeping that type of strategy. On the other hand, nighttime confinement strategies, they may have higher material costs and labor costs relative to daytime confinement strategies, but multi-compartment sheds really do meet the complex needs of poultry raisers to be able to move birds out of the house at night. And poultry raisers are willing to confine poultry in sheds at night as recommended. Watch this space for more on night sheds soon. We've started phase 2 of our project recently, which is another pilot looking at building night sheds among 80 households with a subsidy and without a subsidy. We would like to echo the findings from Chris's presentation, which is that our main takeaway is that poultry raising is a really complex practice to intervene on. flock size, weather, uses of household space, these things change and they influence a household's motivation and ability to engage in poultry confinement and separation of children in poultry. We really do need more research on the type and intensity of child poultry separation interventions that would be needed to reduce children's exposure to poultry feces and yield a health benefit to children as well as poultry. So I'll stop there, but I also want to thank our team at icddr, Johns Hopkins, and Stanford University, who have worked tremendously hard and continue to work tremendously hard on this project. Thank you.
Thanks, Liz. I think thinking of these two presentations together, as you say, we really see the complexity of trying to change the practice of poultry corralling and poultry rearing. We see how chicken behavior changes as well as human behavior. And I think these presentations are also showing just the importance of some smaller scale piloting or tips as we move forward, because there are just so many unanticipated changes that we need to account for. So thank you, and we will continue watching this space. For the sake of time, we're going to move on to the next presentation, but I do ask participants please to, on the Pathable platform, to be chatting in the chat box and to be preparing some questions for our presenters, because we will have time for that. We are going to move quickly to the next presentation and hear from Laura Kwong, who will be presenting on child and maternal well-being impacts of improved floors, still in rural Uganda. Take it away, Laura. Thanks.
Hi, everyone. I'm Laura Kwong from Stanford University, and I've been working on a mixed methods evaluation of the impacts of improved flooring on child and maternal well-being in rural Uganda. This project is with EarthEnable, which is a social enterprise based in Rwanda, which is marketing their proprietary floors in Rwanda and Uganda, primarily for rural households to improve from dirt to an improved floor. Next. So the objectives of the study, there are 4, and the first one is assessing the motivations and barriers for installing improved flooring. The second is evaluating how installation of improved flooring impacts behavior. The third is quantifying the amount of time children and pregnant women spend on improved surfaces and how often they put their hands on other objects in their mouths. And finally, measuring the concentration of soil transmitted helminth, ova, and E. coli on improved and unimproved floors. So our methods are qualitative interviews with 40 current parents and grandparents of young children. About half of these are women. We're also conducting observations of young children and pregnant women, and we're doing these twice within the same week so we can understand children's variation, and conducting floor and soil sampling to look for that contamination. In this presentation, I'll focus on the interviews. Next slide. So here you can see the intervention. You can see a typical dirt floor in a rural Ugandan household there on the left. And these floors are the dirt that was there when the house was built, and they're packed with just by walking on them. And you can see how sort of things are scattered around the floor and can sort of easily get dirty by just the dust and dirt that's sitting there. What EarthEnable does is they have trained masons that come in and they excavate the existing floor. They bring a local material called marum and pack it down. On top of that, they layer sand and then a proprietary varnish, which makes the floor smooth and water resistant. And so you can easily sweep it and mop it. And you can see that floor here on the right side. And like, it looks pretty good. Next slide. So I'll tell you a little bit about the motivations and barriers to installations of floors that were discussed in our household interviews. Next. So some of the motivations are the desire to be clean. And not only is this just the idea of wanting to feel good, but it's actually really, there's a push factor of not wanting to be dirty anymore. When you live in a house with dirt floor, there's just dust on your clothes, on your bed sheets, on your utensils all the time. And so there's both a push and a pull factor here. Households also mention wanting to protect children, visitors, and themselves from rats, parasites, fleas, and lice that can live in the dirt floor, which is often moist and pitted, and it provides a good habitat for these unwelcome critters. Another motivation is to comfortably host visitors overnight. You might have a family member that comes far away and you want to know that they have a comfortable place to be in the evening. People also want to be perceived as clean and healthy, right? Not just achieve that for themselves, but they want others to know that I am a clean and healthy person. And they also said that this increases their respect by other visitors and neighbors. Some barriers are the cost to completing the improved floor in the entire house. The EarthEnable floor is about 10 times cheaper than concrete, so much more affordable for households, but still about $25 a room. And so it might, take a while for a household to complete all the rooms of their house. The floor can also crack if it has prolonged exposure to water. And some households want to jump directly from a dirt floor to a concrete floor. And so are initially uninterested in EarthEnable, but then can become excited when they see that their neighbors have benefited from this floor. Next. So one thing I really love about household infrastructure is that it is enabling, and in this case, like quite permanent, right? It's your floor, so it's gonna stay. And one of the great benefits about the EarthEnable floor is that it is easy to keep clean and clean very thoroughly. And so it also helps you keep your clothes and your bed sheets and your utensils clean. So you might, feel better about cleaning something once because you know it's going to stay clean. Next slide. Not only is the floor motivating, but it's enabling, but it's also motivating. And I think this is really important. That visual feedback from sweeping the floor and seeing that you actually made a difference helps motivate people to continue to sweep. We've had some women tell us that they over sweep and mop. They do it more than they need to because they see one little speck on the floor and they say, oh, I have to sweep that up. That doesn't fit in with my clean floor. People also said that they want to match the standard of cleanliness of their room that is set by the new floor. So they report bathing more frequently or changing into fresh clothes afterwards because they know when they go into their house, their clothes won't immediately become dirty from the floor. They also report that adults and children have started spontaneously removing their shoes before entering the house. And some households report that chickens used to be allowed inside, but they're worried that the chicken urine and defecation will ruin the floor, and so they don't allow chickens inside anymore. Some people have also mentioned wanting to match the organization of the room and say that children no longer throw trash or clothes on the floor, or if that they drop some food that they pick it up. So overall, there's a much cleaner space in which children might want to spend more time. Next slide. So I'll just mention the other parts of this project. We've been doing an exposure assessment, and we find that children are usually outside. And part of this is because there's a perception that if a child's inside, something might be wrong. Like, why are you hanging out inside? Go outside, play. But after there's an improved floor, children spend more time inside because they have this nice area where they can study or rest or eat, where they usually may have done that on an unimproved floor beforehand. Next slide. And the floor sampling is happening next month, but I'll just say that during our method development, we swept a square meter of floor, and on many floors that were improved, we were able to get so little dirt that we can probably not even test it in the lab because there's just not enough there. And that really speaks to how well these floors are being used and maintained. Next slide. So what? Next slide. We have identified several potential short-term benefits due to lower contamination of floors indoors, less time on unimproved outdoor surfaces, less tracking of outdoor contaminants indoors, and less contamination on hands because there's not constant interaction with that dust. Next slide. And potential long-term benefits due to the sort of less tangible, less explored items such as changing into clean clothes, right? Less time sweeping and doing laundry for women, thinking of oneself as a cleaner, more organized person, and feeling more comfortable and at peace. And I think it's really important to look at these long-term benefits in addition to the sort of shorter, microbial risk assessment that we do. What does it say that children grow up in this cleaner environment and might think of themselves as a cleaner, more organized person? How's that going to impact them 10 years on? So my recommendation is for longer-term studies in the future.
Thank you. Thanks, Laura. Before we go on to the next set of presentations, we're going to pause and have a question or two. And then we have another exercise we'll do. But we do have one question that's directed to both Liz and Chris, asking How much do you think your learnings would apply to other animals, not poultry? And do you think that raising other domestic animals is a practice that might be easier to intervene on? That's for Laura or Chris, and Chris.
Sure. So I'll to speak to our context. I mean, I think that our project was motivated by findings that looked at the association between the prevalence of animals in households in rural Uganda and the incidence of both feces observable in the compound as well as disease, and found that poultry in particular were the animal of risk. So I think it's worth noting that. In our sort of more qualitative work in our program design process, we found that other animals that might be larger are more likely to be secured someplace, so less likely to roam as freely. They might also have larger feces, so more likely to be picked up. And I would say as well that in terms of the livelihood practices, poultry are sort of unusually difficult livelihood asset. And because of that, because of all their risk factors, I think it would be easier to intervene with a sort of more holistic model with other animals that are less difficult from a livelihood perspective. So I hope that's helpful.
Yeah, and I think Chris touched on most of the important points there. I'll add that I think that intervening on any animal husbandry practice is likely going to be highly context specific and would require extensive formative research like we've both done here and would highly recommend for other projects. In Bangladesh, we do see that smaller ruminants are also kept inside the home, though similar to Uganda, larger animals might be secured outside. So ruminants might also still be a relatively complex, raising ruminants might be relatively complex to intervene on. I would also say that I think that we need to think about more holistic interventions as well, and think about moving beyond behavior change alone. And I think there was another comment in the comment box talking about the role of vaccination as well as other interventions we might consider that might be more applicable to other animals.
Great. Thank you so much. I think at this point we are going to move on, but I encourage all participants to please still post some more questions in the chat box, and we'll have time at the end of all presentations to handle some more questions. So no, if you go back, please. So as you remember, the whole focus of this session is to look at how to improve hygienic environments for infants and young children. And the next three presentations will be looking at some more options on the spectrum. We've just looked at poultry cooping, poultry management, poultry feces management, and an improved flooring. And in the next set of presentations, we'll look at playpens and safe disposal of child feces, along with animal and poultry management. What you have before you is really a picture of what could be a typical village. And if you look at the drawing on your Zoom screen, you'll see the many transmission routes. And our first game was going to be to please circle all your transmission routes, but we'll let you do that to yourself and look and see. But if you could just switch over now to the Pathable platform, we have another poll, and we're asking you to look at this drawing on the screen. And when you think about all the possible transmission routes that you see before you, the poll question for you is, which of the pathways would you address first? And we're asking you to switch over and vote. And you have to vote to see the results. So you can also see the results to the earlier polls ahead of you. But take just a moment. The results are coming in, and you can tell we have a lot of researchers in the audience because we have the ever popular, I need more data to decide where I'd intervene first. Thank you. Oh, data is jumping ahead. We'll just take one more minute. So looking at the drawing on your Zoom screen, let us know of all the possible places you might intervene to improve hygienic environments. Where would you start? Where would you go first? And our overall winner is I need more data. Second behind, we'd have hand washing before cooking, eating, and feeding. Very interesting. we haven't yet convinced others to look at some of the other spaces. With that, let's shift back to the presentations, if we could. So back to our Zoom platform, and we'll go to the next slide, if you would. Thank you. The next presentation that we'll hear is not one of the USAID small grants presentations, but the group from Cranfield has been colleagues throughout as we are looking at other options for improving hygienic environments. And we're going to hear a presentation by Dr. Paul Hutchings, but presenting for Sophie Budge, of a randomized controlled trial of a baby wash household play space. So with that, Paul.
Thank you, Julia. And as Julia said, my name's Paul, but I'm presenting this work on behalf of Sophie Budge, a PhD researcher at Cranfield University. Sophie's really led the main thrust of this work, but I was part of her supervisory team and broader project team. So I hope to be able to convey the main messages to you today. The work is a result of a nearly 3-year initiative between Cranfield University, People in Need, and Owassa University to use participatory processes to design a play space and then test the feasibility of that play space as a means for reducing infant enteric infection in a selection of communities in rural Ethiopia. Next slide, please. So the hypothesis underpinning the work is that a play space could represent a complementary intervention within the wash space. It's not something to replace our other ways we're trying to reduce this form of enteric infection, but it might help reduce exposure to pathogens, particularly for infants, in terms of soil and feces from contaminated floors. So based on this logic, there was a process through various formative research and participatory design to develop some play spaces. You can see the design on the slide. And then at the end of this process, we've just run a short controlled feasibility trial of the play space with the primary aim really to assess the feasibility of the intervention rather than assess its effectiveness in terms of health outcomes. And this is what I'm presenting here today. So we focus on 4 core attributes of feasibility in terms of understanding recruitment, attrition, adherence, and acceptability. I will present data particularly on adherence and acceptability. And we also did collect data on some secondary outcomes, particularly 2 health-related ones, Campylobacter infection based on presence in infant stools and reported diarrhea. We also collected various social variables like impact on women's time. Next slide, please. So this provides a kind of more detailed map of the research process. I just want to highlight a couple of things. So this is a feasibility trial. So the sample size is small. It's 50 per arm. It's a 2-arm trial. So we are not powered to answer conclusive questions about health impacts. So please, that is the big caveat with this. And the trial was also a relatively short trial. There was baseline measurements, then 2 weeks and 4 weeks. The measurements involved household survey and observational data, spot checks, as well as Campylobacter testing in infant stools based on a selective media technique. There was also some qualitative process evaluation going on at the same time. Next slide, please. So in terms of the results, in terms of the feasibility of this, we set a priori criteria, which I don't think are on this slide, about what we would hope to achieve if we were going to have a feasible intervention. One of them was around not having more than 10% of households stop using the play space during the trial period. And we got 0 for that. That's obviously a reported measure, but that passed our a priori criteria. We then had an indicator based on appropriate use, which was a combination of survey questions and observational data. And we set a criteria of 50%, and we actually just missed that, about 48% at both inspection points. If households that were appropriately using the play space at both times comes out about 48%, so very close, but we just missed that. And then with appropriate cleaning, based again on observational data and survey data, we got to about 50%. There was also inspections of the time infants were in the play space, and this came out at 41% in terms of both inspection points at the household level. So this is some of our feasibility data. If we go to next slide, please. We also collected various kind of secondary outcome data. Some of this was based just on reported benefits that mother or caregivers provided related to the use of the play space. And we were pleased to see some things come out like 56% of mothers reporting that it decreases their workload and time pressures to have a play space like this to keep infants in. And also other interesting secondary outcomes in terms of potentially preventing injury from fire and other risks in that environment. In terms of the health outcomes, we saw a decline in diarrhea, reported diarrhea in both the intervention and the control arms. But we're not quite sure what was going on here because it seems to have fallen in both of them. If you calculate the odds ratio, there was a greater reduction in the intervention arm, but the caveat is that this data is not statistically powered, and there was no difference in the Campylobacter prevalence between the groups. So overall, what we would say from this in terms of assessing feasibility, or next slide, please. Overall, what we would say from this study is that we believe that a household play space could be still a feasible option as part of a complementary WASH intervention. But there were some key learnings that we got mainly from the kind of process evaluation stuff around the provision of cleaning materials alongside the play space, potentially being very important. And also some stuff around kind of child play that will come out in the papers. So I think I'm right at my 6 minutes there. So that's me running through that quite quickly. But that's the team, and really it's Sophie's study, so do please contact her if you're interested to learn more about this work. Thank you.
Thank you, Paul. A brilliant job. Considering that you're presenting on behalf of your colleague, we thank you. While not one of our WASHPaLS studies, this presentation is perhaps of particular interest to me. Some of you know I presented last year on a sort of a companion play space trial, looking at the feasibility and appeal of infant play spaces in Ethiopia. And we really saw a similar perception of benefits. I think what's so important and interesting here is to also have the countermeasures of diarrhea and CAMPI to see what role the play space could play when we look at sort of transformative WASH programming. Ways to really get at breaking the transmission, particular to infants and young children. So I thank you for that. We are going to move on to our next presentation, again, looking at the range of options to improve hygienic environments. And this next presentation, we'll hear from Nicole Caglianese from Food for the Hungry to present on the reduce intervention in DRC. Nicole, thanks.
Thank you. Good morning. My name is Nicole Caglianese with Food for the Hungry and presenting on the Reducing Enteropathy, Diarrhea, Undernutrition, and Contamination in the Environment, or REDUCE program in the DRC. Food for the Hungry is implementing the USAID Bureau for Humanitarian Assistance funded development food security activity in South Kivu and Tanganyika provinces of the DRC with the goal of improving food and nutrition security and economic well-being of vulnerable households under this DEFSA.
Nicole, excuse me for interrupting, and I'm sorry. Your sound is not good for me at all. I'm just wondering if you can get closer to your mic. And otherwise, we can hear you. It's breaking out quite a bit. It could be the rainstorm here, but
okay, yes.
Sorry, much better. Thank you for that interruption. Yep.
Is this better?
Much better.
Okay, sorry about that. Thank you.
Please.
So sorry, I was just saying that FH is partnering with Dr. Christine Marie George, our principal investigator, who is an associate professor at Johns Hopkins School of Public Health, to implement the REDUCE study. Next slide, please. The REDUCE program focuses on identifying exposure pathways to fecal pathogens that are significant contributors to diarrheal diseases and impaired growth for young children, as well as developing scalable interventions to reduce fecal contamination from these pathways. The first step to achieve this was to conduct formative research to identify contextual, psychosocial, and technical factors driving WASH behaviors among caregivers of young children. This qualitative research was carried out through 91 household interviews, 6 focus group discussions, and a pilot study involving 102 households. Using a prospective cohort study design, we investigated the association between child mouthing behaviors and contact with domestic animals and diarrheal disease and impaired growth. The cohort study of 370 children under 5 was conducted in Walungu Territory, South Kivu, DRC, and child mouthing behaviors were assessed through caregiver reports and 5-hour structure interviews. Anthropometric measurements were collected at baseline and 6-month follow-up. And through the cohort study, a risk factor analysis was conducted along with assessment of fecal exposure pathways, as well as an analysis on psychosocial determinants of WASH behaviors. Next slide, please. So results, children observed mouthing feces during structured observations had a significant reduction in height for age Z-score from baseline to the 6-month follow-up. A significant reduction in the height for age Z was also observed for children who came in contact with guinea pigs and rabbits, as well as for children with feces found in their sleeping spaces during unannounced spot checks. The reduced program findings emphasize the urgent need for baby wash interventions targeting child mouthing behaviors, fecal contamination in child living spaces, and child contact with domestic animals in order to reduce exposure to fecal pathogens among susceptible pediatric populations. Next slide, please. So from these findings, the program created evidence-based interventions aimed at stopping child mouthing of feces, reducing child contact with animal feces, as well as water treatment and safe water storage. The program created evidence-based care group lesson plans with targeted behavior change modules and interventions that include locally sourced play mats for keeping children off contaminated surfaces and animal hutches for inside the home. The intervention pilot was carried out in 2 phases, first with 30 households using 6 different technologies, and a phase 2 including 72 households and 6 care group lessons. For phase 1 of the pilot, key messages were communicated using pictorial modules for each target behavior. And for phase 2 of the pilot, expanded care group modules were developed. All care group modules used in phase 2 included pictorial modules from phase 1 of the pilot, a narrative illustration, which was a story showing what could happen if the target behavior was not performed, and an activity to be performed by the care group. Piloting these activities allowed us to obtain key stakeholder feedback, which informed modifications that needed to be made to the intervention materials. Next slide, please. Thank you. So Food for the Hungry uses this care group model in many of our programs. The care group model is a peer-to-peer education model to disseminate information in the communities and allows health communication programs to inexpensively go to scale. In this program, care group promoters introduce not only the care group model lessons, but also the enabling technologies, including the play mats and the hutches, with the accompanying behavior change pictorial module to caregivers. The Baby Wash care group module that was developed included lessons on protecting your child from dangers in the dirt, hand washing with soap, disposal of feces, hutches for small animals, clean drinking water for families, and composting animal feces. The care group lessons and technologies were widely accepted. The animal hutches were particularly well received because families refused to keep animals outside of the home due to fear of theft. So allowing them to have the animals inside of the home but contained, and they were mainly in the kitchen space, provided security from theft while keeping the animals away from eating, sleeping, and play spaces. Next slide, please. So now that the research is complete, Food for the Hungry is incorporating the reduced findings into our existing DRC DIFSA, as well as other programs around the world. The module is among the first Baby Wash care group modules created from a strong evidence base, and FH has now incorporated these Baby Wash care group lessons into our existing modules on hygiene, as well as a new COVID-19 module. And the Baby Wash modules have been used in all of our health zones in the DRC DIFSA, reaching over 1 million people, including 350,000 children under 5. Once completing field testing in the DRC, FH plans to publish the finalized modules and post to caregroupinfo.org. So please stay tuned for those. Quickly, I would like to thank our wonderful study team, including Christine Marie George, our PI, and the entire team at Johns Hopkins School of Public Health, as well as the Food for the Hungry team in DRC. These individuals were supported by funding from USAID Bureau for Humanitarian Assistance under the Development Food Security activity led by Food for the Hungry in DRC. So, thank you.
Thank you. Thanks, Nicole. And you did mention that these baby wash modules are going to be made available soon. When we look back to the first poll, I see we have a pretty even spread of researchers and implementers in our audience. And I know that just finding these tools, these evidence-based tools, are just really a number of our implementers are really hungry to have these. So it's great to see them. And I think it might be really useful to set up some kind of shared site, whether it's we can figure out how to do this, but to make these resources available. I know for our Ethiopia study, we also have a baby wash module as well. And I think the space is really open to start sharing some of these resources for implementers to have some more evidence-based.
Great. I'll post the link to caregroupinfo.org here, and we'll communicate a way to make that publicly known that it's up there when it's ready.
Perfect plug. Thanks so much.
Thank you.
Let's go on to the next presentation so we have more time for some questions. And this will be our final presentation. This final one, it also returns to one of the WASHPaLS behavior change grantees. And we will be hearing about some critical research looking at child feces management. Please go ahead.
Yeah, thank you, Julia. So this is our story of a journey so far. Few years ago, in year 2014-15, Vikas and Emory University came together to evaluate one of the community-led water and sanitation program of Vikas, and we realized that something more than provision of wash infrastructure is needed to substantially reduce the prevalence of waterborne diseases or the diseases which are transmitted through orophycal route. And looking at the data, team decided to look at the child feces management. So how can we change the behavior of caregivers so they adopt safe child feces management practices? And that was the question which led us to adopt the systematic behavior change approach called RANAS. RANAS is actually an acronym for risk, attitude, norms, ability, and self-regulation. How does it work? It works through 4 different stages. First of which is understanding the behavioral factors at play. We did that with the help of qualitative research. Next was measuring the behavioral factors and identifying which one to target. For that, we used the baseline survey and do a non-doer analysis. Third was to select the behavior change technique and design a behavior change strategy. I'll be talking more about it in my later slides. And finally, we'll be implementing it across our study villages and evaluating the strategies and the intervention. Next, please. So how does it work? In RANAS model, a particular behavioral factor is addressed using behavior change technique to address a target behavior. In this case, our target behaviors are safe disposal of child feces into latrine and training the child at young age. So let me explain this with an example. Next, please. So during our doer non-doer analysis, we got to know that mothers who were less likely to safely dispose believed that safe disposal requires a lot of efforts and they did not like it. So what we decided to do is to address this attitudinal factor, decided to apply the persuasive behavior BCT, and in which we showed them a video story of a mother, one who would safely dispose child feces and get benefited and feel happy about it, and another who will not perform the particular behavior. So next, please. The previous was an example. Here is the complete summary of the of our doer non-doer analysis, where you can see the behavioral factors which are addressed in RANAS, that risk, attitude, norm, ability, and self-regulation, and the sub-factors linked to it, and then the BCTs which will be applying to address the particular behavior. Next, please. Yes. So how does this actually work? There is a behavior change strategy, and strategy is actually a BCD plus communication channel. And in this case, we have the strategy of conducting a small group meeting. With this particular strategy, we can address 3 behavioral factors. Attitude by showing a video, making them aware of the cost and benefit of the behavior or the feeling of performing the behavior. And then the ability factor by providing them a hardware to facilitate the behavior. And also, because this is a group meeting, taking an oath or a pledge in a group will lead to a prompt public commitment and address the norms factor. Next, please. So, what were our key takeaways from this entire process so far? We realized that many behavioral factors are at play for both safe disposal and latrine training behavior. But somehow caregivers did not perceive not disposing safely as a risky behavior. Ability factor is important in case of both the behaviors. And that's why this program includes the provision of hardware. We designed and developed this hardware by using the user-centered design approach with the community participation. To know more about this hardware, please visit post number 17 by Valerie Guza. And we also realized that CFM practices change over a period of time as child grows and develops. And that's why the program includes the transitional behavior change from safe disposal to latrine training. What will be our next steps? So far, the entire data which is gathered and the different strategies, which are combination of PCTs and communication channel, are put together to form an intervention. As we are speaking now, this particular intervention is being piloted in 3 villages from the study area, and by including the learnings from a pilot, will be finalizing the intervention, which then will be implemented in 37 villages by Vikas. So that was briefly about our intervention and the action research which we are conducting. Thank you so much.
That's great. Thank you so much, Apurva. That was Apurva Guyam, neither of us introduced to properly, so from Vikas. And we also did want to thank Vikas for that fabulous drawing that your artist whipped up for us, showing the many risk pathways you can find in a village. While we start collecting the questions in the chat box to have the presenters respond to, with respect to that last exercise, the drawing exercise, I was going to ask Laura if you could just speak for 1 minute about some ways where it is possible to identify sort of which pathway can be most relevant. We do know, as we start thinking about developing transformative WASH programs, that we want to have them both be risk-based and context-specific as sort of 2 criteria. And so as far as the risk-based, if you could just quickly address for us some possible ways to do that relative assessment of risk as you start thinking through.
Sure. So I posted a link to my paper that's based on the WASH benefits study in rural Bangladesh, in which we did both environmental sampling and observations of children to see which of those things from the environment, right, hands, water, food, or soil, are going into children's mouth, and based on both the concentrations and the amounts, what is the primary pathway of children's fecal ingestion? So for rural Bangladesh, we find that because soil is incredibly contaminated by animal feces, that direct ingestion of soil is a primary pathway for children that are 6 to 24 months old. And so you can think about a similar thing in your setting, whether it's, you could think about environmental sampling, which I know can be expensive and sometimes out of reach if you don't have a lab or aren't able to set up a field lab, but really thinking about what children are exposed to. And sometimes parents have very poor recall of how much children put soil in their mouths, but in Bangladesh, we found that it was about 1/3 of children put soil in their mouths on a daily basis. So it wouldn't take so many observations to sort of understand if soil is a primary pathway versus other ones. And then another pathway was children putting their dirty hands in their mouth. But I think for many people that have children, you know, it's not really possible to continuously in a maybe a low resource setting. And so that's why we're really focused here on cleaning up the environment by having the animal feces be managed before they dig into the soil. So if you're interested in talking more about thinking about exposure pathways and how you can assess them, please let me know. I'll put my contact information in the chat.
Thanks. I think that's very helpful. And again, looking at the two criteria, risk-based and context-specific, I think that all of these presentations have really emphasized to the importance of customizing for context. A number of the presenters, the activities, did a very concerted user-centered design process. And I'm just going to call out, if I could, for Sophie's presentation, but Paul, if you want to say a word about user-centered design and or Apurva, I know you had some fairly extended user-centered design activities to come up with a context-specific intervention. Any words from either or both of you?
Yes, so I would really like to add that context, our intervention being context specific was very important for us. Made because the settings, or made because of the cultural settings, and and also because of the socioeconomic background. While doing the user-centered design sessions in the village, what we actually did is we went to the village, we asked, what would you like to see if you because they didn't really think that they need some hardware to perform this particular behavior. So it was from inception of the need to creating the hardware, designing the hardware, and then making them use it. So it was very important for us that it should be a context specific thing which has come up from them, and they will get the ownership.
Thank you. Paul?
Yeah, I think as a general process, an emphasis on kind of iteration and the fact that you might not get stuff right to start with. Yeah, we in our case, there was a series of kind of formative research using kind of behavioral barrier analysis and various things like this, and then actually came up with 3 different prototypes, which were initially kind of sketched out using kind of formal design processes and then manufactured by a local artisan, and then brought to communities, and then they were played with, and then we centered onto a particular design from there that had some modifications. But I think even going forward, you know, developing this, we could see the product might change, and households are actually adapting it in slightly different ways, which we're partly worried about from a kind of health efficacy point of view and safety point of view, but we think that's also really important that people, you know, own the spaces in which they live.
Yeah. I share that joy and anxiety of what might happen when people iterate on their own. And I just gave you a slow pitch to tell us about your upcoming publication that you missed.
Yeah, so if you want to learn more about the kind of design process behind our play space, then there's going to be a paper out in the American Journal of Tropical Medicine and Hygiene. It's in press at the moment, so it should be available very soon, or it might even be downloadable now. Great,
thanks for that. I'm going to move us to some other questions, and we're going to shift to other parts of the world. But we have a question in from Bangladesh saying that I'd like to learn some more from Liz or Laura, but learn some more about the Dhaka slum area where you found that so many chickens and birds inside the room. What kind of intervention would you recommend for that? And then I think, sorry, to add, I think thinking about addressing animal feces management in urban areas, so going beyond chickens to think about other ruminants or goats roaming around in slums as well. Sorry to add on that question, but both for Laura and Liz, anything you'd like to talk about in the urban context?
Yeah, I think that those are both really good questions for what learnings we can transfer here. And probably the biggest one is the need for that context-specific formative research and trying to figure out what might work in an urban setting. As Laura mentioned in the chat, we found in our Bangladesh study that space was a major constraint for building any sort of enclosure for confining poultry or other animals in the Bangladesh setting. So that would likely transfer to a more urban setting. So we would need to explore what kind of opportunities or spaces could exist for enclosures, whether that would be safe from the elements and from theft, whether or not that would be attached to the outside of the house or on a roof or something like that. And in the absence of being able to build enclosures in an urban setting, I think we need to think about what we could do that really would be that cater to that more transformative WASH approach, whether that be looking at different cleaning practices of spaces that animals are kept in, improved flooring, improved ventilation. Could these things help to reduce exposure to animal feces in a more urban setting?
Yeah, I would add, I think urban settings often have more improved surfaces. You know, oftentimes there's still dirt roads and things, but those improved surfaces could be cleaned more easily. So I know that children sometimes play in, you know, ditches and things, but if you could at least sweep the main roadway where children are playing and get that stuff off, you might be able to throw it in the ditch. I think there is something to be concerned about, which is building a very small confinement space, you know, right in front of the house or right in the doorway of the house where children might have higher exposure because they're constantly, you know, interacting with the animals in there or being exposed when that the feces are cleaned out with sweeping that goes then directly into the house. So I think, you know, carefully thinking about potential negative impacts would be important when you're thinking about where to place that.
Thank you. Thank you. We're closing in on time. We have one or two more questions we could squeeze in. There's another question about flooring, and it's a good segue from your last, Laura, but someone asked, they'd love to hear what you think about extending the floor to some kind of veranda-like outdoor space that could provide a safe daytime space as well, similar to what was explored in Bangladesh.
I think children want to play and run around, and I think that they're not going to stay on a veranda all day long. So I think that having a veranda done can be nice and can be, you know, a place where you can eat on a clean surface, you know, with your mat down and still be out in the elements and get some more sunlight. But I don't think that you're going to be able to convince children to stay on a veranda all day long. So maybe for very young children, having an outdoor space where you could have like a blanket for a very young child who's not mobile to stay on so that the mother could keep them in sight while she's doing her outdoor chores, or a father could keep them in sight while he's doing his outdoor chores, could be helpful. But once children are mobile, I don't think that an improved service on outdoors is going to, you know, get them to stay in one spot.
Yeah, and making the segue back to playpens, again, another issue there is that it's I think appropriate for a very small age cohort, but once kids start getting mobile, the challenges really will expand. Anything else from our speakers before we do a wrap up? I wish we could open mic for everyone else, but that's not our platform. So I think, please.
Oh, I was just going to say, I think all of us are, you know, from the implementer side and from the researcher side are interested in new collaborations and opportunities and would really be happy to interact with anyone who's been listening and is interested. So I think feel free to find us on the UNC website or in other ways. And, you know, we're always interested in how we can help generate more information to move us all forward.
Thank you. Anything else from our presenters? I think that's a great close. And again, because we do have such a beautiful mix of researchers and implementers, as well as donors, we'll give that plug, but donors in the room, we see the real importance of having these collaborations as we try to define what we mean in this call for transformative WASH, things that really will go beyond traditional WASH and to try and address some of those pathways specific to infant and young children that are impacting growth. And that real importance of being able to test these ideas, but test them in real field settings. First as pilots, using this context-specific user-centered design of some kind or another to really try and move forward and provide some evidence-based platforms for intervention. So with that, we'll say what the cluck. Thank you all very much for joining us. We will, all the resources and things that have been pasted into the chat will be available afterwards. So please do consult, and we ask others if you'd like to put any other reference resources there. It's a great place to network and share, and do seek out different partners to move forward on your interests as well. And with that, we thank you very much. Have a great conference, and we're really pleased you joined us. Thank you all.
I know you at Stanford.